Hello and welcome everyone to today's World Hand Hygiene Day Weber teleclass. My name's Jules Storr and I'll be hosting the class this evening on behalf of the World Health Organization. So we're 18 years into this campaign. Many of you may know that I was there right at the start working as a consultant with the World Health Organization's Infection Prevention and Control team. Many things have happened and the world is a very different place in many respects. But some things remain a constant. The importance, the value of infection prevention and hand hygiene as a central pillar of patient safety remains one of those constants. Next slide. So we have 4 objectives for today's teleclass, and I'll just briefly run through these for clarity. The first is that today is about promoting optimal hand hygiene practice within a healthcare workflow. Secondly, we have the objective relating to the promotion of the inclusion of hand hygiene within national infection prevention and control action plans and standard operating procedures, particularly in healthcare facilities. Thirdly, this teleclass is about raising awareness about the WHO, World Health Organization's Global Action Plan and monitoring framework as it relates specifically to hand hygiene. And finally, the class is about encouraging campaigning and actions to improve both infection prevention and control and hand hygiene itself. Next slide. So the agenda for today will be 3-pronged. We're going to have 3 excellent speakers. We will start with Mandy Deeves, the Technical Officer at World Health Organization, who will talk about hand hygiene and how the world is doing in this year 2026. Really excited to introduce Katerina Mugu, who will talk to us about a new product this year. Katerina works within the HAI, Healthcare Associated Infection, and AMR, Antimicrobial Resistance, within ECDC as an advisor, and she's introducing the High 5 system. And we're going to end with Claire Kilpatrick, who is a consultant to World Health Organization and is going to present around optimizing advocacy and action. And on that note, it's my great pleasure to introduce our first speaker, Mandy Deeves. So over to you, Mandy.
Thank you, Julie. Can I confirm that you can hear me? Yes.
Affirmative.
Yes, okay, thank you. So I'm really happy to be joining here today and speaking about hand hygiene as part of the World Hand Hygiene Day. And to start us off and just frame where we're at all these years later, still talking about hand hygiene. And we're still at that messaging and that clean hands really do still save lives. We have known and we have evidence to tell us that hand hygiene is an important prevention measure to prevent healthcare-associated infections, which continue to be a daily threat to patients in any healthcare setting. We know that it is still clinically meaningful. We know that when hand hygiene failures occur, you can often see mirrored changes in healthcare-associated infection rates and outbreak occurrence. Hand hygiene is also behavioral dependent. It reflects real-world staff behavior. It's not just written policy. Many IPC elements and exist on paper in terms of policies, protocols, and committees, and these are very important. But hand hygiene is something that happens thousands of times a day, requires moment-to-moment decisions, and can be influenced by workload, fatigue, training, and culture. So the performance of hand hygiene really reveals whether infection control is embedded in daily practice and if it's prioritized under pressure by staff performing this practice. So it really does tell us so much about how an IPC system is functioning. It's also system dependent. Good hand hygiene performance depends on multiple system components working together. Availability and placement of alcohol-based hand rubs, access to water, soap, and sinks, training and competency assessment, monitoring and feedback mechanisms, and leadership support and accountability. So if hand hygiene is poor, it can often signal that there are broader system weaknesses that need to be dealt with. Hand hygiene is also measurable and scalable. Like many IPC practices, um, hand hygiene can be directly observed, audited regularly, can be quantified over time, compared across wards, facilities, and countries. And finally, it's linked to patient outcomes. And this is a practice that can be, it's important and relevant in all clinical areas, all healthcare facility settings. So moving on, I just wanted to highlight from a technical perspective and where we're at with hand hygiene programs. And there has been, since the WHO guidance was produced, a lot of these findings tell us that that is still relevant. There have been some updated guidances over the years, and this systematic review is some of the latest evidence looking at that. And we will see from the key messages here that while some of the focus areas may change, the WHO multimodal system is still relevant and meaningful for hand hygiene programs. So we know that hand hygiene compliance varies across healthcare settings and professional roles, and this systematic review reports a range in compliance rates, anywhere from 30 to 90%, depending on, again, the setting and the healthcare professional roles. For settings where the compliance rates with the moments have progressed, there is a bit of a shift looking at quality of hand hygiene practice. And so this assessment of quality of hand hygiene practice is suboptimal. When healthcare workers are performing hand hygiene frequently, they often miss critical areas such as thumbs, fingertips, and wrists, which can create a bit of a gap between the act of doing your hand hygiene and actually having that prevention impact. So having that feedback about technique according to the 6 moments the 5 moments for hand hygiene, as well as the 6 excuse me, the 6-step technique and the 3-step technique have been discussed and reviewed in the literature. And in either case, a focus on promoting that optimal technique still is an important practice to shift to looking at as well. And that seems to be where we're heading. Educational feedback interventions have been shown to improve hand hygiene performance, and that is still true. However, sustainability is the weak point in this. So training and feedback are important to help improve compliance and technique in the short term. However, this intervention on its own will not encourage sustainability over time. So again, needing to look at those multimodal interventions. And finally, we're learning more about automated tools. And those are showing promise, especially as it relates to assessment of quality of hand hygiene. But again, those effects may decline without continuous reinforcement. And there are some challenges with actually integrating those due to cost, infrastructure, and integration into routine care. And just because we're looking at where we're at in 2026, I just wanted to go back to this hand hygiene self-assessment framework study that was done by WHO in 2019, where a number of healthcare facilities across 109 countries, and these countries were representing all WHO regions, was done to assess where programs were at, where countries were at, and healthcare facilities were at in terms of implementing their hand hygiene programs according to the multimodal framework. And this hand hygiene self-assessment framework tool is set up according to the multimodal implementation strategy, looking at system change, training and education, evaluation and feedback, reminders in the workplace, and institutional safety climate. And what we learned, a couple of big takeaways just to share here today, is that this showed significant difference between high-income countries and low-income countries, with high-income countries having more advanced implementation, and that facilities across the globe generally achieved the highest scores in implementing the infrastructure change and making hand hygiene supplies available to enable hand hygiene practice. And we know that with the introduction of alcohol-based hand rubs and tools to support making those locally as well, that this is contributing to some of those infrastructure changes and improvements. However, we still have a lot of work to do. Globally, there are still gaps in infection prevention and control and WASH as an important enabler of infection prevention and control. 1 in 4 healthcare facilities lacks basic water, according to a 2024 report from the Water, Sanitation and Hygiene team in collaboration with UNICEF. And we know that 2 in 5 healthcare facilities lacks basic hand hygiene at points of care and at toilets. And carrying on from that, these reports have shown us that further to that, in fragile settings, less than 1 in 2 in healthcare facilities have basic hand hygiene service. And there are large gaps and inequities between urban and rural settings, as well as hospital and primary care facilities. And we can see in some cases, this gap is as wide as greater than 20%. So just important considerations when we talk about everything so far, everything that we've talked about so far is speaking to the importance of hand hygiene across all of these settings, across clinical areas, across different types of healthcare facilities. It needs to be accessible. If the expectations are the same in all of these settings, then they need the tools and resources to be able to perform hand hygiene. And with the consideration of fragile contexts, this is even something that's becoming a more prevalent concern for us in the current context where so many countries are dealing with ongoing conflicts. So looking now at 2026, this is the moment for action. World Hand Hygiene Day is part of a bigger global infection prevention and control picture. It's part of turning the global strategy into action. And the global strategy I'm talking about is the global strategy for infection prevention and control. There's 3 strategic directions that I'm going to highlight here today, although really there is a strong linkage to hand hygiene from all of these strategic directions. But specifically, looking at strategic direction 2, an active infection prevention and control programs, this speaks to incorporating hand hygiene in national action plans, as well as standard operating procedures at the facility level. Strategic Direction 6 speaks to advocacy and communications, and there are important actions to be done both at a national and at a facility level here as well to promote hand hygiene and infection prevention and control where the advocacy opportunity exists to have these plans nationally and to organize events and communications and campaigns on priority infection prevention and control topics. And World Hand Hygiene Day each year presents us with the opportunity to do that and as an entry to other key IPC messages. This advocacy and communication needs to be strategic and integrated with related programs such as water sanitation and hygiene and antimicrobial resistance to gain support for improvements. And finally, an opportunity to highlight an important indicator for 2026 is to establish hand hygiene compliance monitoring and feedback as a key national indicator, at the very least, in all reference hospitals by this year. And as I mentioned, integration and coordination is really a key to achieving and getting the support and buy-in for these improvements. So we have key strategies and action plans from infection prevention and control, water sanitation and hygiene, and antimicrobial resistance. So these communities can work together and coordinate to hold leaders to account for implementing these plans. These plans get passed because countries have committed to strengthen policies and increase investments to implement these strategies. It's also important to remember that it's not just the big actions and investments, there's also practical actions to be able to implement and make these changes. And WHO has a number of resources to help support that between infection prevention and control resources, as well as the wash fit tools with the water sanitation and hand hygiene teams. So, and here we come to some messages that can help to support and build that case for investment in infection prevention and control and hand hygiene. And as was published last year in our global report, and the investment case for infection prevention and control, including hand hygiene, it was demonstrated that out of 11 different One Health interventions, hand hygiene and environmental hygiene were the most effective and cost-saving investments to reduce AMR across 34 OECD members and EU, EEA countries. This study also demonstrated a strong economic gain to be made by investing in hand hygiene and environmental cleaning programs. So moving on from awareness messaging and opportunities to increase awareness, moving on to action. Action can look different depending on what is important in your facility and in your region at the time. So for example, for our team this year and every year, it's an opportunity to promote the global strategy for infection prevention and control, the action plan and monitoring framework. It's also an opportunity to link new relevant guidance and technical documents that relate to improving IPC practices. So for example, we have guidelines for the prevention of bloodstream infections, focusing on central venous catheters, launching this month and hopefully actually this week. And this document includes some general statements regarding education and hand hygiene practice and highlights the importance of taking the evidence about hand hygiene and infection control practices and embedding them into your standard operating procedures at a facility level. And finally, it's also an opportunity this day to showcase and promote action in countries and in facilities. And this is just in this slide some examples of in different global regions, hand hygiene activities are happening. There were webinars today in the PAHO region, and WHO headquarters had a webinar today, and we're doing this session today. In the Eastern Mediterranean region on Thursday, they'll be highlighting the importance of hand hygiene and IPC in conflict-affected settings as an important action to prevent AMR. And we've also seen relevant publications and presentations on that same topic from our colleagues in Ukraine. In PAHO, they took the message about action and hand hygiene and targeted at maternal and newborn audience in prevention of sepsis. So it's really taking those messages and the campaign and making it meaningful in your region, in your facility. So really the key is to take this day as an opportunity to highlight important messages for your country and facility in order to help enable and accelerate action for IPC improvement. So to end, World Hand Hygiene Day is a strategic moment of action with tangible impact where you can support policy and embedding and moving this into practice, to translate evidence into behavior change, to turn awareness raising into sustained culture change. And I leave you with this slide, which was presented by our chair and colleague, Julie Storr, in a session that was done earlier this month, and was just framed so nicely as a way to kind of, in general, think about the opportunity that World Hand Hygiene Day presents for us all. So thank you for the time, and I now pass over to our colleague, Karina Muguku from ECDC.
Thank you very much, Mandy. So it's really a pleasure to join this class today and to present High Five, which is a digital tool for hand hygiene monitoring that ECDC, the European Centre for Disease Prevention Control, is launching today. And I would like to start with what we often call the hand hygiene paradox. Hand hygiene is one of the simplest, most effective, and low-cost interventions. And yet, despite decades of guidance and evidence, implementation is still inconsistent. One key reason is the lack of measurement of hand hygiene compliance. And there is a simple rule in public health saying if we don't measure something, we cannot improve it. In practice, hand hygiene is rarely monitored in a systematic way. And without measurement, there is no data. And without data, gaps remain invisible. But monitoring the hand hygiene practice can change this. However, this is where the next challenge begins. Even when we do monitor hand hygiene, the process is often heavy. Manual observation, paper forms, data entry, hand-calculated rates, often with errors. It really requires time and staff that IPC teams often don't have. As a result, hand hygiene monitoring becomes sporadic. So the obvious next step is digital monitoring, because digital tools clearly improve monitoring. They offer faster data, fewer errors, automated analysis, real-time feedback. But most existing tools are commercial products, and relying on private companies raises data governance concerns, and of course, costs money. This is the gap ECDC High5 was created to address. The ECDC High5 app was not created actually from scratch. ECDC adopted an existing tool, NOST, originally developed by the Norwegian Public Health Institute, and many Norwegian hospitals have been using it for the past 4 or 5 years with a very positive feedback from their IPC teams. And because NOST is a very user-friendly tool, ECDC decided to adopt it and further develop it, and of course translate from Norwegian to the English language. High5 is built as a progressive web app. This means it runs in a web browser, but feels like a regular app. It can be installed on a phone or computer with its own icon, so no app store is needed. But it cannot be found in app stores because it needs to be first installed in the internal hospital network. High5 automatically adapts to any device, desktop, tablet, or mobile phone. It is secure, and importantly, it can also work offline. High5 is a free tool provided by ECDC. It is currently available in English, with translations into all the European languages planned within the next few months. It includes 3 modules, one for hand hygiene, of course aligned with the WHO 5 hand hygiene moments, one module for the glove use, and one for the bare below the elbows. Importantly, High5 is designed for local implementation, meaning that countries and healthcare facilities should manage the deployment themselves so that they own their data. And this is why there is no central data hosting by ECDC, as we want to ensure data protection and local ownership. I will now show you a short video, only 2 minutes, to give you an overview of how High5 works.
ECDC brings you the High5 app.
I just got the task to register hand hygiene observations at my hospital. This is a great initiative, but I'm not entirely sure how to do it.
You don't need paper forms anymore. High5 is here to make your work easier and faster. Let me show you in only 2 minutes how to use it on your mobile or tablet.
Yes, please, that would be lovely.
I see that the video.
When you log in, you will have the role of observer, which will enable you to register your hand hygiene observations. You will land on this page. To begin, you must click the Start Observation button. In the next page, you select the healthcare facility, department, and unit of the observation. Then select the type of observation, hand hygiene, bare below elbows or gloves. Then indicate if you want to record time and glove use. Finally, tap on the profile of the professionals you will observe.
How do I record which of the 5 hand hygiene moments I observe?
Just select all the moments you are observing. For example, if you are observing a nurse preparing to approach a patient, tap on moment 1 and then choose the icons on the right to indicate whether hand hygiene was done with alcohol-based hand rub, soap and water hand wash, or not done at all. If the time tracking option is activated, the timer will start automatically. Tap again to stop the timer.
Is that it? Is it automatically saved?
Almost. All you have to do is to swipe right to save. Instead, if you swipe the card left, the card gets deleted. However, The observations previously saved using that card are preserved. As you can see, the High5 app is very simple to use, and I am convinced you will enjoy working with it.
Thank you, I agree that the app is very intuitive to use. I am excited to start using it.
Remember, you can consult the High5 website to open the handbook or watch other mini tutorials we have created for you.
I will move to the next slide. And in my last slide, you will see the website of the High5, so you can find this video and other videos so that you can watch them. So in the video, you saw the mobile interface, which is used by the observers. But High5 also has a computer-based interface for the administrators and the coordinators who manage the user access and have an overview of the data. And to help you visualize how this works in practice, let me give you the example of Norway, where they have been using their digital tool Nost. At national level, the Norwegian administrator is based at the Public Health Institute and creates user accounts for the hospitals that want to participate. Then the administrator gives access to hospital level coordinators, who will then manage the observers and oversee the data, but at the facility level. And I will come back to the structure and these roles later. What the video did not show is that High5 automatically calculates compliance rates, and with one click, users can view the results in graphs. High5 is not limited to hand hygiene. Observers can also register practices related to glove use and the bare below the elbows principle. And these are the same modules that were already included in the Norwegian tool Nost. Now that you've seen how the High5 works, let me briefly explain how High5 can be deployed. High5 is designed to be deployed locally, as I mentioned before, meaning that countries or facilities that can be hospitals, long-term care facilities, private practices, they decide how to use High5. There is no central installation or hosting by CDC, so each country, each facility manages its own setup, users, and data. And at ECDC, we decided to follow this approach to give flexibility and data ownership to any country or any facility that decides to install High5. And if I use again the Norway as an example, is because I want to show you how the system can be set up in a country. So Norway has one or two administrators at the Public Health Institute that they give access to different coordinators in the healthcare facilities. Coordinators then manage the observers and the data at the facility level. And it's important to note here that the administrator does not have access to the facility's observation data directly. Each hospital owns its data, and the administrator can only view data that has been transferred to them. For example, in Norway, they have agreed that facilities submit hand hygiene compliance data 3 times per year. And this allows the Public Health Institute to have a national overview and produce annual reports on hand hygiene compliance at the national level. So all the resources are available on the High5 website, and you are more than welcome to contact us using this email address if you're interested in deploying High5 or you have any questions. Thank you very much.
Thank you very much, Katerina, for that session. I'm sure that's really piqued the interest of our audience today. So we're going to move on now to the final speaker, and I'm delighted to introduce Claire Kilpatrick, who will close off today's teleclass. And just to recap, Claire is a consultant to the World Health Organization, and she's going to share valuable insights on optimizing advocacy and action for hand hygiene. Claire, over to you.
Good day to everyone around the world, wherever you are. Welcome again to World Hand Hygiene Day. It's my real pleasure to be invited here to be part of this session, to have just a few moments to reflect on what this day means, to build on what my colleagues have said, and to think about how we move forward with action. Can I have the next slide, please? I want to start with a photograph and a short story to just reflect on this journey. 18 years of World Hand Hygiene Day. This photo, in fact, is from 2014, so a few years after it was launched. And here is Julie Storr, myself, Professor Benedetta Allegranzi, and Professor Didier Petit. We received an award from the University Hospitals Geneva on the occasion of World Hand Hygiene Day in 2014. And it reminded me of all of the people that have been involved in this campaign over many years. But it's not just about those who are part of setting it up and doing the work in the background and providing leadership. It's about what everyone does to create this global movement and to keep it alive. And I'm certainly proud and privileged to have been part of it since it was launched and to be playing one part in keeping it alive. Next slide. So for today's teleclass session, that was my moment one of reflection. Next slide. I'm going to move on to what is my moment two of reflection. And as you might have guessed, of course, there will be 5 moments of reflection as I go through this short slide set. Next slide. What WHO does every year is support campaign planning. And I want to emphasize and acknowledge and thank everyone that contributes to the day, because it takes a huge amount of planning, and not just at the global level, but I hear stories from hospitals. I visited a hospital a month ago and they said, we're still thinking of what we're going to do. And then I spoke to them again last week, and all of a sudden they had plans to visit the operating room, to talk to staff, to revisit the reporting that was posted on the notice boards. Their planning was in place, and it's critical for successful reach. So what we've got here is a tool from WHO that shows global annual campaign advocacy toolkit planning step by step. It again explains the nature of what we call the Save Lives, Clean Your Hand campaign, and walks people through what they can do, what messages they can use, where they might find other resources from WHO, and importantly, when and what you need to do to have that excellent communication and engagement reach. And as we pass through summer or winter, depending on your region, and get towards the end of 2016, we'll be thinking again about planning for World Hand Hygiene Day. So use this resource. I want to remind everyone it exists, and it's a big part of WHO supporting what people can do and plan in each of their countries and facilities. Next slide. Back to 2026. I'm proud to say that we've managed to launch refreshed resources with an excellent team in order to work through those last stages of planning, where maybe in April through to 5th May and after, you're really focusing on advocacy, sharing, and using different materials. And we can all play a role in doing this. So for advocating, we have the standard WHO poster, refreshed again for this year with the slogan, Action Saves Lives, translated into all the UN languages And we've seen many, many other local languages on many platforms, social media, etc., that have been sent to us. Exciting as always to see the adaptation of these materials. We've got a video background screen that can be used anytime to promote that message. When sharing, we've got an email signature. That means when you're sharing any emails, you're actively engaging other people in the importance of this day. We've got a template presentation slide outline. Again, can be used anytime to promote your messages. And when we think about using materials for our own needs, a first for 2026 was a comprehensive digital toolkit, and it contained a number of modifiable resources. Those resources included the modifiable posters, and these were for individuals and for organisations. And not only could you use your own logo and some text, but for a first this year, we provided a whole range of icons. Those icons focus on what you might need to change there in your settings, whether it be for system change and promoting resources, whether it be improving training, improving the culture. Those icons are available for you to use and insert into the resources to target your audiences. And we also had a modifiable social media resource where again you could create your own messages. So part of each year supporting planning, WHO makes sure to make available, even if a small amount of resources, to help you so that we can cut down on the resources and time that you have to take, but make sure that what you have can be adapted to your needs. So not just suitable for World Hand Hygiene Day, but available to use anytime you need to refresh your engagement and communication plans. Next slide. Thank you. And now for moment three's reflection. Next slide. So again, today, all around the world, people are coming together to raise the profile of hand hygiene in healthcare. Let's remind ourselves of that goal of World Hand Hygiene Day. It is primarily targeted at healthcare, but we're happy to see that many people use the occasion to promote messages for many different settings. We want people to be inspired by what is a global movement for 18 years that helps to ensure safe, quality health and care services to protect everyone, not just those receiving care, but those providing care. Next slide. So let's think about what happens and to thank everyone who gets involved. People amplify the message through social media, and that has a huge reach across the world. Every single region of the world has representation from different countries that promote in social media. You see here just some examples. I'm privileged to collate a whole load of information on behalf of WHO to reflect on how the reach has been each year. So we'll continue to do that for the next few weeks until activities have died down, and then we will reflect on just how was that reach, who is involved. But I can tell you already that we have charities, NGOs, hospitals, industry, professional societies, and not only WHO, but the UN itself at that highest level, promoting through its resources World Hand Hygiene Day. And just some of the countries I've seen, too many to mention, but Oman, Nigeria, Japan, USA, the UK, Ethiopia, France, Malta, where I'm privileged to be today as part of a symposium, Egypt, Saudi Arabia, Italy, Mexico, India, the Lebanon, despite all of their challenges, and dear colleagues, they are still committing to World Hand Hygiene Day, Australia and Ireland. We need all of this commitment to keep World Hand Hygiene Day alive every year. And for this social media reach, we also like to thank those specific organisations that are part of the global IPC network for WHO, which includes some on the screen here, but APIC, IPS, HIS, CBIC, IPAC, ICANN, many of these societies that we all know. And also thanks to those industry companies who are part of our private organisations for patient safety. Next slide. We also amplify the message, building on what I said about advocate, share and use, through a presence through different fora. So these again, just some examples. Use of the email signature by different organisations. Use of community platforms and discussion fora. There's a few here on the screen as examples. HIFA for one example, Health Information for All, as well as WHO's own community of practice. We see websites still feature World Hand Hygiene Day, and our approach to engagement and communications changes over the years. There's more social media, but we still see a good presence on websites. And I want to just acknowledge it's not just those in our field of infection prevention, but for example, the Global Association for Dental Societies, you know, everyone is reaching out and ensuring we can share this message, amplify the message. Next slide. I just want to close on the other part of the reach, which will happen again over the coming days, and that is about the events that we all take part in, whether they are small, whether they're a booth in your hospital setting where you gather people, whether it's your own webinars, whether it is an actual day, a half day. This means we're all part of the community and we're reaching new people every time we have these events. Just one part of communication engagement, but many, many happening all over the world, in all regions of the world. And I highlight one example again, the World Federation of the Society of Anesthesiologists. And in fact, a colleague from WHO that I worked with when we launched this campaign is now the CEO of that organisation. And what a joy to see that they're creating and running their own webinar focused on hand hygiene, but for their target audience. This is how we keep the hand hygiene message alive. Next slide. But what is next? I don't want to take too much longer, but this isn't just about one day. Jules has highlighted the objectives for this class, and very similar to the objectives of what we should all be doing together, not just raising awareness for action, and not just promoting inclusion of hand hygiene in our national plans and our SOPs, but continuing to ensure optimal hand hygiene practices. You can do this as well through background facts and messages. They're available from WHO for World Hand Hygiene Day 2026, but they're also available in the past years. There's such a range of messages. These resources are not just for today. You can use them anytime. And we're privileged to have a scientific commentary in a journal this year, the Journal of Hospital Infection, and that reaches a different audience. That allows us to talk about the science of infection prevention and the role of hand hygiene. So different communications, different media reach different audiences. And that's why our planning is so important when we're thinking about who we want to reach. Next slide. So my moment for reflection as we move through, next slide, really is about how we go forward. So I'm going to return to where we started, that multimodal improvement strategy that we have evidence for that works in order to sustain improvement for hand hygiene. Now, one of those, of course, is reminders and communications, and our campaign activities are part of that. But what I want to emphasize is the option that you have to use the global drivers of the WHO documents once again to promote the multimodal strategy as you go forward. And this isn't an unachievable attainment, isn't a gold standard. What in fact it is a recommendation within is the minimum requirements for IPC. the minimum that all our programs should be doing to achieve that improvement. The multimodal strategy is part of that. So again, for implementation and improvement, many resources available. Please do take a look. Next slide. So let's just all come together online, remind ourselves about this strategy, and remind us what it looks like, what it sounds like. We want to build it, teach it, check it, sell it, and live it. And that's proportional to your local situation. A situation where you will understand how to get a balance between these 5 elements in order to see improvement. And that's important because reading this quote from Mary Dixon Woods in an article previously published, too often problems in the quality and safety of healthcare are merely described or admired rather than fixed. The effort invested in collecting information, which of course is essential, is not matched by the effort in making improvement. If you take nothing else away from today, apart from a great new resource and high five, then please think about this. We have to match those improvement efforts, and we have the tools to do that today. Next slide. Multimodal strategy is a behaviour change intervention. Let's not forget that. Let's promote that. We have behaviour change at our fingertips because it's challenging. This runs through the WHO guidelines for hand hygiene, where behavioural scientists and other experts were part of taking that build it, teach it, check it, sell it, live it, and making sure it was truly informed by behavioural approaches and theories, because that is the most effective way to help reduce HAI. Next slide. So to close off moment 4's reflection, it really is about the range of resources that are available, and not just about the 5 moments, not just about posters, but about all the resources that help that multimodal strategy. Recommendations around alcohol hand rub, around how we train on hand hygiene, including the My 5 Moments for Hand Hygiene game that you can all use on your desktop, launched a few years ago. Observation tools, and now of course we have a new electronic tool. And importantly, the hand hygiene self-assessment framework, which I encourage you all to revisit, because it's only 6 pages long and it tells us where we can restart wherever we are in the journey. And what it tells us is that we value and support hand hygiene, and that means we're living it, that safety climate, that we're committed to sustained improvement. Next slide. So my moment 5 for today's session is the role of effective champions and role models, the WHO recommendations. You can be part of this because we are all champions, but the evidence around the role of champions has existed for quite some time, a few decades. And it's not only in the current WHO recommendations and strategic directions, but was in the core components for IPC, which Julie Storr led on, issued in 2016. I cannot quite believe the core components are 10 years old, but I want to shout out to a new scientific publication which will be launched soon in the Lancet, which is a review of the core components as they apply to long-term care. This will be published soon. Please take a look. But thinking about what you can do, there's the Global Research Agenda for Hand Hygiene Improvement in Healthcare, which outlines research priorities. I really do urge everyone to look at this. If you have ideas, small, big studies, let's not repeat what we've done before. Let's address these gaps. And 4 of the gaps in the priorities relate to the role of champions. This is how I think we need to consider going forward as part of a multimodal strategy, but it's a recommendation and we should be looking at revitalising that approach. Next slide. The systematic approach to the role of champions is really a call to action, because I want to emphasise what the literature tells us. It's not just about identifying a champion and saying you're a champion. It's about preparing people. It's about having the supportive system around them. It's about recognising the qualities they have in the sphere of influence. It's about recognising that it shouldn't be just the most junior staff. For effective action, we need to address that role of a champion, as well as the positive local working environment, institutional support, interprofessional culture, orientation, ongoing trainings and support. So for the WHO community of practice, I'd really love to hear feedback on how people are addressing this and how we might go forward with this idea. Next slide. So I started with a photograph and I want to end with some photographs. Thinking of champions, it's my great pleasure to work with so many amazing people. And in 2014, when we launched the badge for World Hand Hygiene Day, which you can use year on year to show that you're part of the community, we asked colleagues to take their photograph with the badge. And I'm really proud to be part of this work and to continue to promote World Hand Hygiene Day, because as quoted by colleagues in Mexico, hand hygiene campaigning from WHO has helped us to get more people engaged and working towards a change of mindset for better patient safety culture. And I know that's what we all want to see. Next slide. So I mentioned the community of practice. Thank you for listening. Check out the resources and please do join the community so that we can have more discussion together. Thank you very much.
Thank you, Claire. Thank you to all of the three speakers. We've heard three very different but complementary perspectives today, from strategy to innovation to advocacy. And to bring this together and keep us focused on action, I'd like to invite one or any of you to answer a single question in one sentence, if you may. If you had to choose one thing that every healthcare system or setting could do in the next year to most improve hand hygiene, what would it be? I open the floor to Claire and to Mandy and to Katerina. Please don't feel obliged to answer in the interest of time, but if any of you would like to answer that question in a single sentence, then please, I open the floor.
Jules, if okay, I'll just mention very quickly, I think because I've just finished, not to be unimodal in my answer, but I really believe that role of champions is underutilized. We're not thinking about who they could be. I've asked this question a lot recently to colleagues in different countries, and we're not thinking about sphere of influence, the range of people that they could be. Maybe the word doesn't work, champion or role model. Maybe we need to get up to speed and call them influencers, because I do believe they have a role in all of this improvement work. So I'd like to see more feedback on that.
Thank you, Claire. Mandy,
Yeah.
Katerina? Mandy,
Yeah.
over to you.
I'm going to just quickly jump in. It's funny how we're quite aligned. Before Claire said the champions, I thought of advocacy, and I think you know, that having the right people doing the advocacy is an important piece of that. And maybe because I was focusing on that strategic lens, I just thought, you know, there's a certain amount that you could do at the grassroots level, and making hand hygiene practice important and enabling that. But I think there are some, you know, there's a reason that we are still working to implement and make behavior change happen, and to make environments enabling to support infection control and hand hygiene. And I think that advocacy piece is so important to try and gain that buy-in, and to have other people view it as important as we do, especially those people who need to make investments. So very aligned, I think, with what Claire was saying.
That's great. Thank you, Mandy. Katerina, would you like to offer any reflection on this question?
Yes, thank you. For me, it's more a question of how often, and not really what, what type of intervention could be different in different settings, because there are different needs, different priorities. But how often? So to implement something systematically, I think this is essential. We know that just implement once is not enough. Whatever you implement, do it systematically.
Yeah, absolutely, 100%. That's great. Look, we've come in on time, and I thank you, all three of you, once again. And I'd like to thank Weber Training for these excellent teleclasses, which I know are of great value to all of us. You can see here on the screen the forthcoming sessions through May 14th up to the 27th. There's some great talks coming up, and I'm sure that you will be interested to register for these. And on that note, I'll thank Paul Weber, Weber Training, and the teleclass sponsors, the patron sponsors on the screen, Diversi, Virox, and IFIC, the International Federation of Infection Control. And thank you all for joining us on World Hand Hygiene Day 2026. We will see you all in 1 year's time. Thank you.